All right, time for some pre-cals. What's going on today, gents?
Hey, we have Dr. Sahil Chopra who's with us today, and I'm super excited to have him with us. There's a number of companies that are now online doing telehealth and doing sleep medicine. He's doing it a little bit different than most, and I think where I really started to pick up on, him and what his company was doing and his practice was when he started doing a bunch of different videos on LinkedIn and
Right?
talking about different types of sleep disorders and how their practice was managing those patients and so just really super informative information and you know I, I have to also admit too that I'm completely jealous of his hair. I think he's got the best hair in sleep medicine
I
and
I would I would agree.
Yeah, it's pretty stellar.
it's tough to be good looking, well spoken, and have good hair. And that's a tough living. I wouldn't know what that's like.
I'd say all three of us would agree to that.
100%.
Come a close second, but let's see what's happening. You guys ready for the show?
Absolutely.
All right, folks, on to the show.
Now, a word from our sponsor, MedBridge Healthcare. MedBridge Healthcare is a leading provider of sleep lab management services and home sleep apnea testing. MedBridge partners with hospitals, healthcare systems, and medical academic institutions to offer comprehensive, fully integrated services for sleep disorders.
Lights out.
Welcome, everyone, once again to another episode of Sleep Tech Talk, the sleep podcast with your hosts and friends, Emerson Kerr, Robin Miller, and me, Dr. Gerald George Mannikarote. Folks, we've got another fantastic episode today with a really, really special guest. But before we get started, just want to say thank you to each and every one of you for listening, for joining us, for subscribing, and most importantly, sharing it with all of your friends out there. So be sure to like, subscribe, and share with everyone. And now to get us kicked off, Robert, what's going on today?
Hey, Jerry, thank you so much. And we're excited today to have with us Dr. Sahil Chopra, who is a co founder of a new online telemedicine service called Empower Sleep. He's also a quadruple boarded sleep physician, critical care, pulmonary, and internal medicine physician as well. And he has a significant online presence. If you follow him or are connected with him on LinkedIn, I'm sure you've seen some of the live and different videos that he has been a part of. So we're excited to have him with us today, Dr. Chopra. Thank you for joining us.
No, thank you guys. I've been following the Sleep Tech Talk podcast for quite some time now, and I love all the information that you all are disseminating, and it's really a privilege and pleasure to spend time with you guys today.
Well, let's start with we typically try to get into first, sort of how you got into sleep medicine, and I know that it has become a significant passion for you. Do you mind sharing with us at least the early stages of your sleep medicine interest?
Yeah, no, absolutely. It was kind of by accident. My pretty humble beginnings. I went to med school in India. I did residency in internal medicine at UCLA. I worked as a hospitalist for a few years before going back to do my pulmonary and critical care fellowship at Loma Linda University. And I didn't even know what sleep medicine was as a field until my pulm crit fellowship. And I think many of us uh, who are pulmonologists who go into sleep have experienced that. And this was back in 2016, 2017, 2018, 2019. And basically what was happening, there was this sort of rise adoption, increase in the slope of adoption of wearables. And we were just seeing a lot of patients that were coming to pulmonary sleep clinic for an evaluation. And it would take these patients like months to get in, months to get a sleep test, months to get started on treatment. And it was just a very clunky experience. Um, and you would go through the whole process, and unfortunately, sometimes a year would go by, and then Medicare would say that the sleep study is too old and you need to do it again. And it was just like this, like blew my mind away that like this person's been hypoxic, 40, 50, 60 apneic events per hour. And it was just like a very broken system. Like the consumer world was so beautiful, so nice, so easy to do. And then the healthcare sleep world was just so broken and clunky. So like that idea of sleep care being broken, that kind of bothered me. And the other thing that was happening was our fellowship had become extremely busy. We were bouncing between days and nights, and we had a young family at the time. So I was very sleep deprived myself. So like the idea of not sleeping well, and then like seeing how many people have a sleep issue and then not getting like, half decent care, that just got me very curious in the world of sleep. And eventually ended up doing a fellowship, luckily matched in Boston, was at Harvard for a year. Beth Israel Deaconess Medical Center, Boston Children's, and MGH. They have a combined program. And those guys opened my eyes to what sleep medicine could be and what are some of the possibilities. And I kind of went into sleep medicine thinking it was like OSA medicine or sleep apnea medicine or insomnia medicine, which is like, I think many of us do that. And the second you get in and you understand circadian science and sleep science and breathing science and cardiovascular science, these are all different processes that happen that just happen to be happening during the process of sleep. And that's what sleep medicine actually is what are all the processes that happen during sleep? How do you take one from pathology back to physiology? And I started to think about sleep medicine as a field that way. And it's just been very exciting. We try to look at sleep very holistically. For example, uh, addressing someone's hypertension is very different than improving their cardiovascular health. Addressing Alzheimer's is very different than improving brain health. The same thing is true for sleep. And addressing sleep apnea or insomnia is very different than improving sleep health. So the idea of like sleep health with all of the different physiologic parameters, sleep vitals, that was all introduced to me purely because of my mentors in fellowship. And ever since then, there's really been like no looking back at the idea of Harvard grade sleep care, as we sort of jokingly say this sometimes.
Dr. Chopra, we have a mutual friend with Dr. Thomas. He's such an abstract, complex thinker. How did working with him inform you and even shape the direction you're in now with where you're taking Empower Sleep?
Yeah, Dr. Thomas he's something else. When I went into the fellowship, I used to think he is a very abstract thinker, and I was kind of bothered by it at the time. But the more I got to know him, and the more I got to understand how he sees sleep, the physiology of sleep, it became so clear to me that this guy is like decades ahead of any of us can possibly even start to imagine what he actually sees. When we would be reading PSGs every Wednesday, so our fellowship was very different in the sense that we actually spent time every Friday night at the lab in what were called these MD nights. Like most fellows go into sleep medicine because it's an easy fellowship. For us, I think every other Friday we would actually spend time at the lab doing the titration studies, and Dr. Thomas would be there. And we would see how like sleep unfolds for humans across time over the course of that night with different pressures, non-vented masks, dead space, like all of the things that, he's educated us to do. And like when you see that what he is saying makes sense from a physiologic standpoint, and it corrects pathology in front of your eyes as you're seeing the EEG roll out on the screen, you just become everything he starts saying makes complete sense. And he's so deeply rooted in the physiology of sleep that once you start seeing sleep as a physiologic process, then the whole perspective of sleep medicine changes fundamentally. Because what happens today is like a payer-driven approach to delivering sleep care. But what we learned in fellowship and what was sort of ingrained into our head is like, let's think of a physiology-driven approach to sleep care that mitigates the burden of pathology, reversing pathology to restore physiology. And yeah, like Dr. Thomas, I give him he's one of our advisors, and I give him all the credit for shaping how I think about sleep and also other fields of medicine.
With that in mind, how has that really shaped what you're doing with Empower Sleep? Because clearly it's informed your journey as a sleep physician. But as you stepped out into this world of telemedicine and all aspects of that, how has that shaped it? Because so many that we see in this field are especially that come on our podcast, they're entrepreneurial thinkers, and they're thinking about the future. How did all that come together for you to launch Empower Sleep?
Yeah, it's a great question. How Empower Sleep started and what it is evolving to become is very different than where we began off. And I think, like, many of us saw many of these clinic in the clouds pop up during the pandemic, some of which have become very successful. And it's basically replicating the model that happens on the ground and then just taking it to the cloud. The very simplest, like just a clinic in the cloud model. But what happens in the clinic doesn't necessarily work well. It's a one-night study, either at home or in a lab. That study gets used, unfortunately, kind of in a binary way. Either you have sleep apnea or you don't. If you have sleep apnea, you have one of three or two different options. And if you don't have sleep apnea, but you don't sleep well, these patients get kind of lost to the system. And so that doesn't necessarily help anybody. It doesn't help the patient improve their sleep. It's easy for the physicians, but it's hard for the patients. So, like, what we've evolved into is more of a continuous testing platform that uses continuous sleep vitals to help deliver very personalized care. So what that means is, and at least where we are today, and as I mentioned, it continues to evolve. Right now, our patients and our members, we mail them one of the sleep image home sleep testing devices, and they just test sort of as many nights as they want to. We start off with a 14-day, a 2-week trend rather than a one-night snapshot. We get 2 weeks of data. Through the Empower Sleep app, the patient can see what's happening to their sleep across time, from a sleep quality, stable sleep, unstable sleep, all of the different parameters that are in sleep. We advise them to run different experiments during this 14-day period to see what influences their sleep in a positive way or a negative way. And then based off of that, we come up with a very personalized care plan that is dynamic. And during the course of their care with us, they continue to test. So if let's say someone has sleep apnea, we'll prescribe them CPAP. It'll be delivered to their home, and they continue to test over the course of time. And then we do like this home titration of their PAP to them using the data from the detailed report from the downloads, plus the sleep image data that we get on a continuous basis. And then using that, and sometimes what happens is PAP fixes breathing, but it doesn't fix sleep, right? Like, and this happens once you look for it, it starts happening very often. And then it's like, okay, well, PAP did fix breathing. It destroyed your sleep. Your fragmentation went through the chart. Your stable sleep went significantly lower. Then now let's look for a different solution. Then you can explore dental appliances, INAP, and then we help like users, patients figure out what's going to be that right stack of solutions that helps them improve their sleep, resolve the disorder, and get sleep to be as physiologic as possible. And that's just one example. The same thing is true for, say, someone who has insomnia. Most people with insomnia, they don't even get a sleep test. No one orders a sleep test. They just get a sedative or a hypnotic, or someone sends them to a behavioral specialist to do CBTI. But when you start doing sleep testing for people who have insomnia, you discover some of them have 30–40% of them have some level of sleep disorder breathing. And if they don't, there's also different endotypes of insomnia. You have it in people who have some level of insomnia, whether sleep onset, maintenance, or early morning awakening, with preserved sleep quality. And some people have insomnia with reduced sleep quality, similar to how how things are in heart failure. You have heart failure with reduced EF, and you have heart failure with preserved EF. This is like we're seeing the same thing in sleep disorders. Like you have sleep disorders with preserved sleep quality, and you have sleep disorders with reduced sleep quality. And like what that means is you have someone who may have sleep disorder breathing who's a good sleeper, but you can also have someone who has sleep disorder breathing who's a poor sleeper. They both have to be addressed very differently if we're trying to optimize their sleep vitals. But traditional thinking doesn't really tell us to do that because it's very driven by this apnea hypopnea index model, which is maybe a little bit simplified. But what I'm trying to get to is when you have this longitudinal data of someone's sleep vitals across time, it really empowers you to help them make clinically sound decisions that are rooted in physiology, that are backed by the data, because you have this closed feedback loop system and you can actually see what's working and what's not working. And it's been really like eye-opening for me. It's been a privilege to be able to help people and learn all the things that we've been able to learn over the last year and a half.
So, Dr. Chopra, we need to get you involved with more payers and helping to develop payer policy, because that also helps to drive a lot of the if X then Y sort of patient management, if you would, from a clinical practice perspective. So I love what you're doing, but we need the payers to sort of come along with with this more comprehensive model too, because I was just talking to somebody this morning about insomnia. And what if we had what if insomnia, or some components of identifying patients who struggle with insomnia but who are new to CPAP therapy, what if we were sort of managing both of those things at the same time? Because it could be that a patient who has insomnia is not adherent to their CPAP, but we haven't addressed the insomnia at all, because we're going off the information that we got from the sleep study, which showed that they had obstructive sleep apnea, of course.
Sleep tech looking for new opportunities? Well, MedBridge Healthcare is one of the largest employers of sleep technologists, and they are growing. If you are a sleep technologist interested in a new position, potential paid relocation, or looking for a career advancement, consider a career with MedBridge Healthcare. Now back to the show.
Well, so just number one, I'm advocating for you to help with payer development in the future at some point when you can. Maybe they'll start watching some of your videos that you do on LinkedIn, because I know you do some really unique educational spots on and maybe some other social media platforms. So could you tell us a little bit about that and what the objective is there? Because they're very good and they're very informative, and I know our audience needs to find your videos and listen to them too.
Yeah, no. So regarding your first comment on the payers, it's something that we're working on. We've collected close to 250,000 hours of medical grade diagnostic sleep data over the last year and a half. That is rich in context from patients because they're journaling. It's rich in data from down like CPAP, Excite, INAP, whatever, whatever stack of interventions. So we've learned a lot about human sleep across time for thousands of people now. And this is allowing us to phenotype and endotype individuals in a much more intelligent way. And this is what allows us to get to radically better outcomes much faster. And this is exactly where we're going with this, Robert, is we're going to go to the payers, whether it's value-based care or employers or just the big Aetnas and Uniteds of the world, to say, hey, like, based off of our data, our outcomes, we can get people to healthy sleep faster. And therefore, like, please let us take care of your patients, because if we can do that, we can help reduce overall cost of care that you guys are having to deal with for the people that you take care of, and you don't have the outcomes that we do. And when I refer to outcomes, I'm like, I don't like this idea of adherence or compliance, but that happens as a default once somebody is sleeping better. If someone sleeps better with something, then compliance behaviorally goes up, right? We've all seen this in like the REM dominant sleep apnea. This like autopap of 20 does just phenomenally well, because that kind of phenotype just can tolerate that kind of pressure variation and so forth. But if you yeah, so like that's exactly where we're going with this, is using the data that we have, the care plans that are dynamic that we figured out, and we're going to be able to provide care to more people in a more cost-effective way over time. And from like the content side, the content is kind of interesting. I'm kind of an introvert, and it's been just a way to practice getting information out there on the importance of sleep. What are different modalities that actually can improve your sleep? Because, being a physician myself, and you guys have probably seen this, there's a lot of different things that people may tell us that improve their sleep, but as providers and clinicians, we're like, oh, where's the data behind this? Like, let me look at the research, and the research is not statistically significant, or it was a small clinical trial, or it was a retrospective study. We're always pointing fingers in all of these things, and that is not conducive to innovation most of the time. But at the same time, we have our own. We have to be thoughtful of what we recommend to patients. But the really interesting thing has been that using continuous sleep vitals, we can actually test a lot of these miscellaneous tools like mouth taping or nose dilators or nasal sprays. And in some people, these solutions actually improve their sleep better than does like a prescriptive solution. Like I've taken people off of CPAP because I have objective data that someone who has mild sleep apnea, who keeps their mouth closed, has better nasal breathing, who is using like a REM plenish myostraw plus myofunctional therapy, actually has better sleep and better breathing without CPAP than does with CPAP, because CPAP causes more fragmentation of their sleep, but breathing is, healthy. So like, so the content that we tried to, tinker with is more of getting the information out there that there are a lot of solutions available, but they need to be tested in the right individual. And really just to drive awareness of, if someone's sleep is healthy and physiologic, there are a whole host of downstream consequences that are positive that one can have the fruits of.
So, Doc, it's really interesting to hear this, because, what you said, many of us, when we get into the sleep world of sleep medicine, you're looking at it as a sleep apnea medicine or insomnia medicine. We tend to forget the other aspects of it, or in this case, that, hey, this patient has OSA, but they have other things on the side as well, or along with it. And I guess my question to you is, how did you stumble into that you have to look beyond just one or the other?
When you start testing over time, So when you see, if you know what normal sleep looks like, then the goal becomes, how do I, sorry, let me take a step back. If you understand and you can see what the process of normal sleep looked like for one individual, then one can work backwards to start figuring out and dissecting what can I do as a clinician, either through prescriptive interventions or through recommendations, to get this person back to the physiologic process of sleep. And that's intentional because you're not saying, what does someone's normal breathing look like? But the question is, what does normal sleep look like? So that means sleep architecture, that means heart rate dipping, that means blood pressure dipping, that means um, body temperature dropping, that means growth hormone spiking towards the latter end of the night, that means their melatonin profile, right? That means all of these different things. Like if you do once you start exploring the processes of sleep and you say, okay, this is broken, this is broken, this is broken, this is broken, but you know what normal is, then you can start working backwards, just helping one get back to what is more physiologic from a state of something that is very pathologic. So then like this whole idea of even insomnia becomes very sort of the tip of the iceberg of this process, this active process of sleeping. If that
So
makes any
before
sense.
before Jerry jumps in here at some point, starts to get ready to cut us off. So at some point, I mean, you've already sort of developed something that is very different than a traditional sleep medicine practice, even though there's the telehealth component to it. Where do you see? And I know that you also keep up with the trends of new technologies and things that are out there. Where do you see sleep medicine sort of headed? And what are some of your predictions about sleep medicine for the future?
I don't know, Robert. I think that's the honest answer. But I can share with you where we want to take what we do. And we want, so I'm a believer that if sleep is good, sleep is the best medicine, right? Like everything has, sleep and exercise are probably the best medicines. They have, if someone's sleep is healthy or if they exercise, they're the strongest levers that one can pull to extend their health span and optimize lifespan. I think there's enough evidence to support that. And our job is, and our mission is to provide these tools and care to as many people as possible. And in the process of doing this, if we can inspire other physicians to start thinking about sleep from a more physiologic approach rather than like a pair approach or just a very simplistic guideline approach, I think it'll have tremendous influence on the health of society. It can have a tremendous influence on the health of society from a population standpoint. And so yeah, I mean that's where we are trying to move into. But from like a overall trend standpoint of what is going to happen to sleep medicine, who knows, man? Like the American Academy of Sleep Medicine will have to weigh in, the pairs will have to weigh in, and that's not something that we can do anything about today, but we can hopefully inspire other organizations to start looking at sleep in a more holistic fashion rather than just a oversimplified fashion. And that's what we hope to do.
Well, Doc, thank you so much. This has been really, really fascinating, this conversation. And before we close, it is unfortunately closing time, but before we close, could you tell us a little bit about Empower Sleep?
Empower Sleep is a health tech services platform, where we help individuals improve their sleep in a very holistic fashion using both prescriptive and non-prescriptive interventions. And we use that on the foundation of continuous sleep testing. So patients can do continuous testing in the comfort of their home. We've recently incorporated an Onera system too, so like we can even do level 2 testing in the comfort of their home to really provide individuals an end-to-end solution where the goal is improve sleep physiology, and once sleep physiology is back to normal, people feel fundamentally different. And that's what we do. And you can go to empowersleep.com if you have any questions and sign up directly there. And if you have any questions, please let us know. We look forward to taking care of you.
Hey, thanks, Doc. And where can people find more information about you?
Empowersleep.com is probably the best place. And you can also send me an email directly. The email address is Sahil Chopra MD at empowersleep.com.
Fantastic. Well, Doc, it's been really, really excellent having this conversation. We got really deep into the sleep topics, which all of us geeks love to talk about and ponder. And we really appreciate everything you're doing and your vision for the organization, for your company. But more importantly, like you said, to inspire others to do the same as well. So thank you once again for joining us.
No, thank you, Jerry. Thank you, Robert. Thank you, Emerson. It's been a pleasure to chat with you guys today.
And thank you to all our listeners, all our viewers out there. We can't thank you enough for being there with us. We also want to say a huge shout out to our sponsors. And don't forget to like, subscribe, and most importantly, share. Until next time, we say, lights on.
Before we go, we would like to thank our sponsor, MedBridge Healthcare. MedBridge Healthcare is developing innovative inpatient, post-discharge, and population health programs to screen comorbid conditions, diagnose and treat sleep disorders. Learn more about their innovative solutions and career opportunities at medbridgehealthcare.com. Once again, you can learn more about their innovative solutions and career opportunities at medbridgehealthcare.com.
Okay, another show. Time for some post-cals. What do you guys think?
That was a great show. I think we could have talked for probably another 30 minutes to an hour because the approach that Dr. Chopra has on medicine is so different than what we're typically used to.
Right.
The way that he approaches the patient, the holistic approach, is extraordinary. And just to hear that deep dive, the journey, there's sort of that mystery when we talk about a physician out of Harvard. What are they going to be like? And he really meets that expectation of a physician that spent nights in the lab. I mean, I don't know of many physicians that I've even met that have ever done a titration on a patient. And to hear him talk about his journey and how it informed where he is now, I mean, it speaks well of what Empower Sleep is about and what we got to hear about today.
I agree, man. It was a really, really good conversation. And what do you guys think? I think it would be great if we had him back on the show to talk a little bit more about what he's doing.
I think because it's so different than just a general, I think most sleep medicine practices are driven by the payers. And we talked a little bit about that. And, he's not letting that be the barrier to him doing the right thing for a patient, which is pretty unique, I think, in the healthcare space. So, no, absolutely. I'd love to, once he has some success with a payer, because, he mentioned that he's got all this data that he's able to pull and take to a payer. I'd love to see, some successes in that space. And we talked, he said he wasn't sure about what the future looks like, but maybe he's going to be a part of helping to shape the future, just by virtue of bringing a different, more comprehensive approach to patient management.
I agree. I think that's a great place to stop. What do you just think?
You can't add to what we had today. It was
exactly
too good.
Yep. Good stuff.
I agree.
I didn't even get to tell a joke today, except maybe about his good hair.
Wow. That wasn't a joke. That was real. That was real, man. That was
Yes.
real.
Yes.
You folks who are listening on audio, you need to hop onto YouTube and see that version of it. All right, folks, until next time, thank you so much. Cheers.